one of the key stakeholders in that fight, as we have been doing over the years. I would say, have a little comment of a year. The team says what? Safeguarding the teenage girl, a clarion call for the action. But we can count the number of males or the boys in this room. Meanwhile, when it comes to teenage pregnancy, it takes two to tango. So the question is, where are our boys? We have, over the past, focusing too much on the girls. But when it comes to taking decisions as to whether to have safer sex, to have sex or not to have sex, it's always taken by the boy or the males. So the question now here is, where are our boys? If really we want to fight this canker, we have to start looking at involving the boys or the males. If not, all the talks, whatever, will be in vain. I will call on the other stakeholders, especially the adults. Please don't let us intimidate them. Let's allow them, whatever is bothering them. Let's put them at the center. We are now talking about meaningful youth participation in all manner of issues concerning young people. We need to involve them.
We are very committed to the well-being of children in Ghana and the whole world. That is why we take it serious that just last year alone, over 107,000 girls got pregnant. That is those that were recorded. It is serious, and we need to really look at it, especially when 2,865 of them are between 10 and 14. So we are not just looking at a problem for teenagers. We are looking at children. Because if 10, I don't think 10, 11, 12 are teenagers yet. So if this is how frightening the situation is, and we all need to build strong support and collaboration to arrest the issue. World Vision has been doing a lot in terms of preventing teenage pregnancy, and some of them that we do is ensuring child participation in the discourse. The time where children were passive participants in this discussion is over. Whether we like it or not, they are actively involved, and we need to actively involve them as such. I'm very happy that as part of the celebration, we are going to train child ambassadors to do sensitization in various communities and schools. Yes, that is putting them at the forefront, letting them discuss things that concern their lives. And we can't be much happier about it. Gone were the days we said parents do not talk about sex and other things with their children. That is over now. Parents must know responsible parenting and must be part of it. So I'm happy that once again the NYA wants to do community sensitization, bringing parents involved and letting them know of their responsibilities in parenting.
2006, in Banjul, Gambia, on the occasion of the adoption of the African Youth Charter, the African Union Commission designated the 1st of November as Africa Youth Day to recognize and promote the central role of youth as agents of economic empowerment, social change, and sustainable development in Africa. Today, on the 15th anniversary of the Africa Youth Day, I am delighted to be here with you in this historic and beautiful city of Cape Coast, a city which connects continental Africans to African people everywhere to commemorate Africa Youth Day 2021. Keeping up with the general theme of the Agenda 2063, the continental theme for the day for this year's celebration is Defining the Future Today, Youth-Led Solutions for Building the Africa We Want. That is the global theme for this year's Africa Youth Day. Defining the future today, youth-led solutions for building the Africa we want. Nananom, Agenda 2063 mandates special attention to the gender dimension in the building of the Africa we want. This entails ending all violence and discrimination against women, as well as taking positive steps to realize the economic, social, and political advancement of women. This obligation is further emphasized in varying degrees by Goals 1, 2, 3, 4, and 5 of the Sustainable Development Goals. Defining the future today, as the theme demands, therefore, requires envisaging what problems may exist in the future and uprooting the sources of those problems today. With reference to our special obligation to African women, defining the future today means addressing the impediments to the comprehensive development of African women. The scourge of teenage pregnancies has been a major impediment to African women, and in particular, Ghanaian women realizing their full potential. As I referenced last month, in the National Consultation on Reproductive Health Education for out-of-school young people, figures from the District Health Information Management System of the Ghana Health Service suggests that 109,888 teenage pregnancies were recorded in 2020 alone. Of this number, 2,865 pregnancies were from girls aged between 10 and 14. These ages are below the age of statutory consent. The figures from last year continue an alarming trend of high teenage pregnancies recorded. It is nothing new. The same DHIMS report that I referenced further revealed that about 555,575 cases of teenage pregnancies were recorded between 2016 and 2020, with an attendant figure amongst girls between the ages of 10 and 14 being 13,444. This suggests that on the average, 112,800 teenage girls get pregnant every year. Unfortunately, the Asante, Eastern, and Central regions record the highest rates of teenage pregnancy in the country. Nananum, ladies and gentlemen, heightened risks of premature labor, spontaneous abortions, stillbirths, the development of fistulas, and higher rates of maternal mortality are associated with teenage pregnancies. Hence, teenage pregnancies constitute a major threat to the health and well-being and raises concern as far as Goal 3 of the SDGs are concerned. Beyond the health risks associated with teenage pregnancies, significant social and economic consequences often follow teenagers who successfully carry their pregnancies to term. These consequences often mean teenage girls who have children and at times their teenage partners cannot fulfill their academic potential and are deprived of the skills to become financially independent in future. This cycle of poverty, hunger, and deprivation of quality education is occasioned as a result of teenage pregnancies. Similarly, invoke goals 1, 3, and 4 of the SDGs. Nananom, it is in the view of the above that the National Youth Authority is dedicating the Africa Youth Day to addressing this issue of teenage pregnancies to ensure that the future of the Ghanaian women and African women by extension is defined by their participation in all spheres of economic, social, and political life. Accordingly, our local theme for the 2021 Africa Youth Day celebration is Safeguarding the Teenage Girl, a clarion call to action. Because we realize that protecting the teenage girl today will produce the educated, independent, and innovative Africa woman we want tomorrow. Very soon, my deputy, Mr. Nelson Osu-Ansah, Nana Chairman, who, by the way, is celebrating his birthday today, will shortly elaborate on why our team will be accompanied by a campaign which will rely heavily on the support of youth leaders and youth influencers in areas with high prevalence of teenage pregnancies to address the issue. The empowerment of the youth to solve issues pertaining to the youth not only operationalizes the call for youth-led solutions for building the Africa we want, it also reflects our belief that youth can do it. We at the National Youth Authority have a firm belief in the can-do spirit of the Ghanaian youth, and we want to employ and deploy them as agents of change in the areas where we find this challenge to be prevalent. Ladies and gentlemen, Nananom, I welcome you to our celebration of the 2021 Africa Youth Day, and I employ our religious and traditional leaders, development partners, opinion leaders, young people, and all other stakeholders to engage themselves in this campaign to decisively tackle the menace of teenage pregnancy in our country, for we believe, to rephrase the timeless words of Dr. James Kwegyir Aggrey, if you safeguard the teenage boy, you safely and simply safeguard an individual. But if you safeguard the teenage girl, you safeguard the whole nation. We thank you for your audience.
My name is Emmanuel Akoto. I work with Planned Parenthood Association of Ghana, which is a bit alarming. As a region, some time back, though, we said that we've done something. Initially, we used to be at the top. Now we are third on the ladder, which means much effort have been made to be where we are now. But still, there is more work to be done as a region, and therefore we need all key stakeholders. You were part of this program. You heard the various presentations, and you know your role as media. You have a big role to play as the media, as well as other key stakeholders, and there are various roles that they are supposed to play. For me, I think that if all the key stakeholders are to play their role, I'm sure come 2034, as Professor Kumitreme indicated in his presentation, we'll be able to reduce it by, for instance, by half. But for me, I would have wished that we bring on board the boys, because it takes the two to tango. If the men don't have sex, if the boys don't have unprotected sex with the ladies, how would they become pregnant? So for me, a program like this, yes, even though there were, but the males or the boys that I saw around were not enough. We also need to target them. I'm happy that this is just the launch. After this launch, there's going to be community programs. And I wish that when they start the community sensitization and the campaigns and whatever, they have to also include the boys. You should find out from the men, their involvement, the boys, what can they also do as partners to reduce teenage pregnancy.
We said during the program, today is African Youth Day to commemorate and celebrate the Ghanaian youth. We are confident that the youth of Ghana have enormous potentials in contributing to the socio-economic development of our country. And so we are here in Cape Coast today to celebrate the Ghanaian youth. Whilst we are at it, we are dedicating today to the campaign towards eradicating or reducing the canker of teenage pregnancy. The data we have reviewed from the Ghana Health Service are alarming. Over the last year alone, over 100,000 young teenage girls were recorded as those who attended upon the Ghana Health Service structures, hospitals and clinics and health centers. We are aware that there are several larger numbers who may not even have reported at the health centers. From 2016 to 2020, about 500,000 and over young ladies who should otherwise have been in schools or should have been acquiring skills have been reported to have gotten pregnant. And we at the National Youth Authority thought that this was a challenge we had to confront. The data is clear that Ashanti region is leading, Eastern region follows, and Central region also comes third. And so we chose to come to Central region to begin the conversation around how we can keep this menace and nip it in the bud. We are grateful to the Regional Coordinating Council, especially the Regional Minister, Honorable Mary Godasan, for the support of the RCC in mobilizing people and resource persons to support this intervention. And we should leave here having launched the campaign Safeguarding the Teenage Girl. That's the campaign that we have just launched. The campaign aims to equip some local youth influencers, young persons who would be agents of change and who will help us to spread the message. So we are grateful. To you, the media, we ask you to continue to partner with us so you can send the information down.
Teenage pregnancy has snatched the dreams and destroyed the achievements of teenagers. In fact, they are left in pieces. My little advice to you, the teenage girl. Look at this girl. Once a young, elegant teenager indeed. Once a cute, innocent young girl with knowledge about her sexual pleasure, the only way she had peace, the only coming she had felt was that from a loving mother. Now she finds herself among teenage pregnancy census and statistics. In fact, if she knew, she would have been much pathetic and applied some tactics. Yet it's too late that she is a pregnant teenager. All this she didn't be pushed at her because her family never paid attention to her. She was left alone to go and beg and live for her own life. And then she fell into the traces. And then followed the traces. Traces drawn down by her friends and so to entirely her bones. Being a teenager comes with curiosity and adventure. And then everyone, especially the family, must set a barrier to prevent danger. If this had been so, if this had been rightly put, she would have free. Yes, you would have been free from the painful regret of premarital sex, from the painful flashback of nudity in pornography. She would have been free from the painful regret of losing her body, from the enslavement of masturbation. And I continue, and heaven would have been intact. Her breast devoid of all the touches, the circuit of men with chanting, far beyond being her babies. No fear of mixing the next period. Saved from the side effects of contraceptives. Saved from the deadly abortions. And yes, saved from teenage pregnancy. Now they're hiding of premarital sexual activities. And they're hiding of devastating physical, psychological, and emotional destruction and effects. My dear mom, make your story of how you overcame a testimony to your daughters. Daughters, my dear teenage girls, listen and pray and don't tell me that